And
no,
we're live.
Welcome everyone to your COVID-19 communityresources.com town hall meeting powered by the Center for Closing the Health Gap. Today, we're going to talk about the long-awaited COVID vaccine. It is here, almost here, and we're gonna answer questions, dispel myths. This has been a week of scary news. Earlier this week, we heard that this past Wednesday was the third deadliest day in U.S. history. We lost 3,103 people in one day to COVID. So it is scary. Everybody is anxious about hearing about the vaccine. Two big questions. Can we get it if we want it? And then should we even take it? So there are a lot of questions out there. We're going to get to that in just a minute. I'm Councilmember Jan-Michele Kearney. I am co-moderating with superstar Tropikana from Radio 1, and we are excited to be here. We have a stellar panel. Before Tropikana introduces our panelists, let's give a shout out to our tech team who make it all happen. We've got Jan-Michele, and we have from Northwestern University, Sloan Harris. So welcome both of you. Thank you so much for making everything happen for us. As a reminder, everybody, we are recording so that we can post this session later on the COVID-19 communityresources.com website and also other sites, okay? To all our attendees, if you're on Facebook and you already know, because we've been talking, you can put your questions in the chat. If you're here on Zoom, put your questions in the Q&A, and we're going to get to them after just a quick intro of all of our panelists. So let me turn the program over for the introductions to Tropikana.
Thank you very much, Ms. Jan-Michele Kearney. How are you doing today? So good to see you as always. We do have a very stellar panel today, and I'm so excited to ask all of the questions that have been coming to my inbox. And with no other ado, I'd like to introduce our panel to you. Dr. Michael Thomas from the Cincinnati Medical Association, Dr. Lou Edje from the Cincinnati Medical Association, Dr. Camille Jones from the Cincinnati Medical Association, and Ms. Felicia Beckham. She's a registered nurse from the Black Nurse Association of Greater Cincinnati. They have some great information that they're going to share with us so that we can be educated and be safe as we move forward during this fight with COVID-19. But before we get started answering your questions, let's hear a few words from our other panelists. Dr. Michael Thomas, would you like to share some words?
Yes, my name is Mike Thomas. I'm the chair of OBGYN at the University of Cincinnati and UC Health. I participated in the COVID-19 vaccine trial and I'm doing very well. And because of that, and don't know what I got, but hopefully if I did get the vaccine, am very hopeful that it will be very protective, as well as I think that everyone, when it comes out, when you get your opportunity, you should get the vaccine. And for those women who are pregnant, or are about to become pregnant, there's still a lot of data that's not out about that side of things, and we can talk about that a little bit later.
Oh, okay. Okay, who's next?
Dr. Lou Edje, would you like to share some words with us?
Absolutely. Thank you so much for having me. I just wanted to thank Renee Mahaffey Harry, first of all, for being the kind of person that when you meet her, you just really wish you'd met her 12 years earlier, at least. So thank you for that. I also do want to say an additional thank you to the medical teams out there, from medical students, residents, fellows, and attendings, and all the team around them that help us take care of our COVID patients and have been doing so, going through that deep bench over and over and over again for several months. And then to my UC Health family and my UC College of Medicine family as well for their support. I, like Dr. Thomas, am a participant in the Moderna trial. I'm also a practicing family physician here in town and want to impact the patients who I take care of. I have two analogies that I just want to lay on the table here today. The first one is the cake analogy, and I'll use that for the vaccine. So first of all, everyone's been saying, and this is really good for use when you're trying to think this has been way, way too fast in the making. It's unfortunate that it was called Operation Warp Speed from my standpoint. But if you think about the cake, we have been studying coronaviruses since 20 years ago, specifically. And so we baked the cake and iced it for a full 20 years, and we have just been working on the cherry that goes on the top for the past year. So this is a 21-year-old cake. Secondly, the analogy, the car is for the virus, and mRNA is basically an instruction booklet for how to make the emblem on the hood of a car. The specific car, let's take it being a Mustang, being the virus. And so that emblem, it gets wrapped in a little bit of fat, so it actually is protected as it gets into your body and get into your cells. And then your body is able to recognize that little emblem as a Mustang and is able to build the tools to dismantle that car when it drives into your driveway and render it into the scrap heap and take care of it for you. So the car would be the virus, and the cake, long in the making, would be the vaccine.
I love that cake analogy. That's very reassuring.
It is. It definitely helps me understand things a little bit better as well. Dr. Camille Jones, would you share some words with us, please?
Yes, thank you. And thank you for inviting me. So I'm going to start out by just saying what we already know, that COVID-19 is not a myth, it's real, and most people continue to be at risk of infections. We're having a lot of community spread with increasing number of cases. And yesterday, another 237 people in Cincinnati alone were diagnosed, with younger adults 29 and 30 to 39 leading the way. About 1 out of every 100 people diagnosed with COVID in Cincinnati have died. So this is not the common cold. And currently we know that 18% of the COVID tests, the tests for the coronavirus, are coming back positive. That's very high. Only about a month or so ago, it was 5%. Now it's 18% coming back positive. But still, most of us have not yet gotten the virus. The total number of people known to have been infected to date is about 5 to 10%. Okay, but however, depending on how we're exposed, the type of exposure, how heavy the dose, and how long the exposure is, most of us will become infected in time. Okay, there are public health measures that can decrease your chance of getting infected, and we need to keep doing them consistently. And we're not going to be able to let up until about 80% of the population has either been vaccinated against the virus or infected, which is probably going to be about 12 months from now. The measures are: wear a mask when around people you don't live with, keep physical distance of 6 feet, which is about 2 arm lengths between yourself and other people you don't live with, avoid crowds, and especially avoid crowds in indoor venues because the virus is airborne and can stay in the air for about 3 hours. So you want to avoid being in an enclosed space with a lot of people breathing and talking and shouting and all that kind of stuff. Wash your hands repeatedly during the day. Try to avoid touching your face, your mouth, your nose, your eyes. Stay in if you feel sick. And this is not to avoid getting coronavirus, but this is avoid getting the double dose. Get the flu vaccine this year, even if you don't usually get the flu vaccine, get it this year. So we know there's no cure for coronavirus. There's only supportive care. We know in Cincinnati, about 85% of the people who are diagnosed were symptomatic, and about 6% of the folks who are diagnosed are going into the hospital because they got so sick that they need oxygen or anticoagulants or treatments to decrease cytokine storm, which is that severe reaction that can lead to severe lung disease, organ failure, and death. And so about 6 to 7% are getting hospitalized in Cincinnati. We're already at the point where hospitals are becoming full because of the wide community spread. And we're looking now to see the increase in cases coming from the Thanksgiving travel, which is going to really surge right before Christmas. And then if people are traveling around Christmas time, then we're going to pile on to that surge going into January. So the ICUs are becoming full of COVID patients. And that means that people who have normal diseases like heart attacks or other things that also need hospitalization are going to be competing for beds because of the COVID patients who are in there. And we also know that as hospital workers get sick, we're going to have difficulty staffing the care for these beds. So, so we're in a bad situation, and prevention is the way to respond. So we know that vaccines have been very helpful in preventing a lot of highly infectious airborne diseases like measles, mumps, smallpox, polio, influenza. We know that it helps. We also know coronavirus has especially impacted Black, Latinx, and Native communities in terms of severe disease and deaths. And so we can't afford to have a knee-jerk avoidance to potentially life-saving preventive therapy. So, I was invited, as were the other members of this panel, both as a physician, but also as a person who has volunteered to participate in a phase 3 clinical trial. I also was in the Moderna trial. And so I'll be urging people to take a vaccine when it becomes available to you. I'm not telling people to do anything I wouldn't do. You just, when the vaccines become available, you look at the data, it's 3 questions. Is it safe? Is it effective? And is it effective for people like me?
Okay. Ooh, I've got a ton of questions, but let's keep going. Let's keep going with the intros. I'm sorry, Tropikana. I'm just like,
No problem, same. I need to correct her title. Felicia Beckham is our nurse practitioner from the Cincinnati Black Nurse Practitioner Network. Felicia, would you like to share some words with us, please?
Thank you for having me. Yes, I've been a nurse practitioner for over 6 years. I've been a registered nurse for over 12 years. My background has been in critical care in emergency room and also in the ICU at UC. Currently working in the primary care setting at the Health Experiences, where we have an integrative healthcare model that specializes in substance abuse, mental health, and then also primary care as well. Also formed an organization called the Cincinnati Black Nurse Practitioners Network, where we founded over 50 Black NPs. So we have worked diligently, not only working 9 to 5, but also in the community as well, helping the community partners with COVID testing and education, and also giving out, hygiene bags throughout this time too, because we know that the community needs it. So thank you for having us, and thank you for using this platform to educate people that look like us, so we can also, they can hear it as well.
thank you so much. Oh, I'm so excited. I'm just like brimming with questions, but I see we already have a ton in the Q&A. So I'll hold mine for a minute. Let's go to the first question on the Q&A, and it is, how long will the vaccine last?
I can take that one. So I'm enrolled in the trial for 25 months, and that is to try and help determine how long the vaccine causes a conferred immunity. And what we do know for sure is that if you get immunity out at least about 4 months, usually you're able to have a longer term immunity that is lasting, usually about 2 years at least. And so we have already passed that mark for some of those phase 3 trial participants, and therefore are able to state we've gotten that far. That gives us a significant amount of hope, but this trial is not ending anytime soon. It's 25 months coming down the pike. So we will give you more information on that.
So the 3 of you were actually in the trial. Does that mean you're not going to, you don't know if you have the placebo or the real vaccine, but now that the vaccine is here and you're all in the healthcare profession, will you all get the vaccine, or do you have to wait out the whole 2 years?
So that is a great question. More on that later.
Okay. All right. We're going to hold that. All right. Let's go. Okay.
It's my impression that I was told that if you indeed want to break the blind in order to get the vaccine, because the vaccine is available, that you could request knowing whether or not you have the antibodies. And if you have the antibodies, then you wouldn't need to get the current vaccine. So it's really up to the person, and they would then continue to monitor you. And I know that there was an email that was sent to the vaccine participants that you could potentially get the Moderna vaccine early if indeed you did not develop antibodies. And it's hard to tell what happened. Some people, when they received the vaccine, they had no symptoms whatsoever, primarily due to possibly the vaccine, or could be to the saline. For some of us, like myself, I don't know whether or not I got the vaccine or the real messenger RNA or the saline, but I know after the first injection, I got a little swelling in the arm. And after the second injection, I got chills and fatigue and some stomach upset for about 24 hours. And then that next day, I got the injection on a Wednesday, had some upset stomach and fever, well, not fever, but fatigue and body aches. And then by Friday, it was completely gone.
Oh, you probably got the vaccine, Dr. Thomas.
So I hope so, or else I have the worst reaction to saline anyone could ever have.
The other thing to note as well is that the recommendations, and we just had the CDC go ahead and put out a report. We're still waiting for the full report that came out at 2:30 today. But the ACIP, the CDC limb, that tells you when you can take your measles, mumps, rubella, and things like that. They met to talk about this this vaccine and for Pfizer. And one of the things that we do know for sure is that, you know, if they are 16 or over, you can absolutely go ahead and take the vaccine. Additionally, if you have had COVID before, they are recommending that you take the vaccine anyway. Additionally, if you are sick with COVID at the time, you should probably wait 90 days before you actually go ahead and get the actual vaccination. So again, if you've had COVID, that does not confer protection. We are still recommending you get it, you know, as far as the vaccine goes.
Okay, all right. Thanks.
And the other thing is that, and I'm sorry to upsert your the program, but the other thing that came out was that at least the guidance from Moderna is even if you get the first vaccine, because they're 4 weeks apart, if you get the first one, that starts to give you some degree of protection, because if you get COVID between the time you get the first vaccine and the second vaccine, any symptoms related to COVID would be much likely to be more decreased than if you had waited and gotten COVID after the second vaccine.
Okay, let me ask you this. This is just a quick question because you're talking about getting symptoms and getting stomach upset. So does the Moderna vaccine have the live virus in it or not? It doesn't, does it?
No.
No, that's why I was mentioning the emblem of the car. All you have is the instruction on how to fight the virus. So it's recognizable, but there's absolutely not a lick of virus. That's the only reason I got into this particular study. So the instruction on how to make the spike protein, which is one of 29 proteins that makes up the virus, that little protein is the only thing that the instructions were made to go into the vaccine, and then your body's able to recognize that. And once it sees the whole thing, it already has all the tools ready to dismantle that Mustang, as I mentioned before. So not a lick of virus is in there. And that's why the safety profile of this is up in the 95% efficaciousness and safety wise.
No,
Now,
what
there will
about
also
the
be-
Pfizer one? What about the Pfizer one, Dr. Jones?
Pfizer is still an mRNA. Both Pfizer and Moderna are what they're called messenger RNA. So they're just telling you that little snippet of information on how to make the protein for the spike part of the coronavirus that trains your body to react against it. Some of the other vaccines coming up are using a live virus, but it's not a live coronavirus. They're using adenovirus, some of them, to deliver the instructions on how to make that spike protein to the cells so that you can train your body.
Okay, so no one's getting live coronavirus injected into them.
That's
Okay,
correct.
that's good to know. Okay, now Dr. Thomas brought up pregnancy. So Christine Moore wants to know, what are the current recommendations for pregnancy and the COVID vaccine?
Well, I will tell you, but there are no recommendations yet because no pregnant patients were studied in any of the trials, or people who were postpartum, so after pregnancy. None of those patients were studied, but we're about to, I just approved our recommendation is that if there is a pregnant patient who wants it, we as a department of OBGYN are recommending that they should get it and should be in the priority group that they fall into, including people who are healthcare workers. It's not necessarily thought it would be harmful. There is no data, but our thought is that it's probably better to get it than to be around patients who have it. But as of now, the FDA has not recommended it. They've not come out with any guidance related to it.
Okay, all right, that's good to know. I should have given a shout out to Lauren Harden on our tech team, and she's sending us questions from Facebook. Thanks, Lauren. Okay, so here's a question from Easy Connect from Facebook. Okay, it is a great question. Do you need to be rich, politically connected, or in medicine in order to receive the vaccine? Who gets that vaccine?
There's a tier of that's recommended right now, which is first high-risk healthcare workers. So it's not going to be all healthcare workers, but the ones who are sort of in high-risk exposures, long-term care residents and staff. This is in Ohio. That's sort of where, and other congregate living situations are the ones who are in the first tier. It's probably going to take about, certainly those are the folks who are going to get it before the end of December. And then as other doses of the vaccine roll out, then you're going to have people who are first responders, you're going to have people who have chronic medical diseases or who are older. are going to be sort of in that second tier. And there's a lot of discussion about who else is going to be in that second tier. Everybody's going to be able to get it probably by the end of 2021. And except for the Pfizer one, there should not be a cost for it.
Okay, all right, thanks.
Okay, Dr. Edje and Dr. Thomas, we have some questions that are coming in as you guys are speaking, and they've missed part of your statement. So just for clarity, these two questions are similar. Is Dr. Mike saying that if you already have had COVID-19, then you don't have to take the vaccine? And for the general population that are not part of the trial, if they have COVID antibodies present, do they need to receive the vaccine? Dr. Edje, you kind of spoke on that. Could you clarify that again?
Yes. So current recommendation is if you've had COVID itself, yes, you should get the vaccine. And if you are actively having COVID symptoms and you've been diagnosed with COVID, you need to usually wait then. The recommendation is you wait for 90 days afterwards to, yes, get the vaccine.
Okay, Dr. Can you ask Dr. Thomas a question too?
I did, Dr. Thomas. She kind of answered that as well, though. The question is also from Easy Connect, and he was saying that if you've already had COVID, then you don't have to take the vaccine, and she answered that.
Okay, all right, great. Okay. So here's a question. This person is anonymous, and as we said, it's fine to, you don't have to give us your name, but has or will everyone on this panel take the vaccine? Are all of you like pro taking the vaccine?
Absolutely, 110%. I've lost 4 family members to COVID. My mother-in-law, my stepmother was the very first person, and that just jolted me into the reality of this. I take care of patients, I read about it, I'm a physician, but for it to really, really hit home, that loss, she was healthy. It took 1 week and she was gone. I have my daughter's uncle, he was 53, reggae, bodybuilder, and in a week he was gone. These are people who would never be at my dining table again. And it breaks my heart. I wish I could turn back time. Take the vaccine. I mean, there is absolutely, do not believe, and I understand there's a long runway littered with systemic racism. I know that there are trials out there, Tuskegee included, that really cloud us with suspicion about why would they put us first in line. The reason that they're saying we are in that second tier is because 71% of us who get it die or get really, really ill from this. We need to get it. This saves lives. There's absolutely no question this virus management with this particular type of vaccine saves lives.
I have to agree that it's very important. The reason I got into the trial was to try to be a role model and example. As a older Black male, it's very important that you get the vaccine. It's very important that, I was hoping that I got the actually real vaccine. I still don't know, but to be able to say that you will get through this. It's very important that we in our community take this vaccine so that we can help others and hopefully convince others to take the vaccine. This is the only way we're going to get to the other side of this.
Okay, thank you. Ms. Beckham, what about you? Okay. Well, okay, Dr. Jones, hold on 1 second.
Yeah, no, let me go after her.
Yeah, Ms. Beckham hasn't had a chance to weigh in on it.
So if you just look at your response to just the pathogen, and there hasn't been any other answer to combat this pathogen, and the vaccine is definitely needed. For me, I need a little bit more data in regards to longitudinal data that the benefits outweigh the risk. Now, the benefits do outweigh the risk in a sense that death is on the table. So if you're looking at it from a memory standpoint, where if you can get a vaccine, have a little bit of memory inside of your body, and where you have exposure to this coronavirus, then you can combat it. So therefore you have extra protection. We just don't know long-term what that looks like for us. So it's kind of like building the airplane as we're flying it. So right now the deaths have to decrease. And how we measure that is the amount of vaccines that people can get to be protected. So, like she said, the decision-making process depends on your experience and your knowledge. So it's very, very tricky to determine whether everyone will get it as well. And then also you have to really look at the meeting people where they are, and also looking at the barriers to getting this vaccine too. So I hope that, everyone has an opportunity to get it when it is available for everyone.
Okay, all right, thank you. Dr. Jones, I know you're about to weigh in on it too.
There's two other things. One is that we need to not be left economically behind. And already people are talking about, once you get the vaccine, getting sort of like the vaccine card to show that you've been vaccinated. And there may be actually economic benefits from having been vaccinated in terms of access to employment and that sort of thing, that I would say that we should not be left behind. The other thing is that a lot of this putting Black people in front of the line is not coming from benevolent other people. It's coming from our own people advocating vigorously for us because of the deaths and the sickness that our community is facing.
Okay, all right, good to know. Now Tropikana, go ahead, I'm sorry.
No, I was just saying, I'm happy that she clarified that and said that, because that is one of the biggest fears amongst my my demographic, my Facebook family, my listeners. I hear them say that often and all the time, that why do they want us to take it first? Why do we have to be the guinea pig? And they are in fear of that. So it's reassuring to hear Dr. Jones say that it's not that they're trying to, guinea pig you. It's us fighting so that you can have a chance to live without it affecting your family and us taking continual losses. So thank you, Dr. Jones, for saying that.
The other thing that dovetails right off of that is, I'm sorry, just dovetailing right off of that, the virus itself was developed by two major scientists at NIH, one of whom leads the coronavirus research lab, Camille Jones is a Black woman. So she is one of the two people responsible for actually creating this Moderna, specifically the Moderna vaccine. So, again, we have representation in the making of the vaccine, in the suggested rollout, and that is something that also needs to be known.
Tell us her name, please.
Camille, otherwise known as Kizzy Corbett. Dr. Kizzy Corbett. She's a brilliant 34-year-old Black woman.
Oh my goodness, we need to celebrate her. That's fantastic.
We do. She works with Dr. Fauci, who everyone seems to, respect Dr. Fauci. He's phenomenal. He respects Kizzy Corbett.
That's fantastic. Dr. Thomas, we were cutting you off. I got so excited hearing about Dr. Corbett. So
now I was going to say, I was sort of kind of defending back the whole guinea pig thing. Dr. Edje, Dr. Jones, and myself have been the guinea pig so that we can help to let you guys know that it's safe. We're still here.
Right.
No problem.
That's exactly right.
The guinea pig stage is over. Now it's safe to do it.
Okay.
That's exactly right. Really well said.
Thank you guys for taking that risk for us so that we can trust and move forward to just fighting COVID. It's amazing to be able to have access to doctors who look like us and that can explain it to us and that can show that it's a completely different time. Yes, we were afraid of Tuskegee. That definitely happened.
Yes.
But then we didn't have a Dr. Edje or a Dr. Thomas or Felicia Beckham or Dr. Jones in those positions. So I'm glad that we have access to this information. Thank you guys for just taking the lead for us.
You're welcome.
That is phenomenal. Okay, here's some questions about who should take it. So Annette Bell said, how safe is a vaccine for people with diabetes, heart disease, and cancer survivors? And there's another question. I just want to put this with another question about, and this is from Craig 3G, and it said, just as some polio vaccines resulted in paralysis, what's the chance of a middle-aged African-American male contracting the disease and succumbing to it? So kind of, what are the risks for people who have comorbidities, is a term we've learned how to say lately?
Short-term risks, not there. But that you have to look for long-term risks, because this is a trial where I can speak for the Moderna one, that was 30,000 people, half of whom got the active treatment. So that's 15,000, and they've at least had a median time of look of at least 2 months, and that hasn't happened.
Okay, all right.
But keep in mind, this is not a live virus. This is just a way of just allowing your body to fight these, to fight the virus, that any virus that has a spike on it. And that's what your body is being tuned for. All you're doing is trying to get that information in to fight these spiked viruses that you could potentially come in contact with. So it's not going to affect any other portion of your body. It's just there patrolling around looking for the bad stuff that would be the coronavirus. And that's all it's doing. So that there should not be any long-term adverse or bad effects from this vaccine.
Not only that, the mRNA, as you know, it gets unstable very, very fast. That's why it's actually wrapped in, tiny, tiny, tiny little microscopic droplets of fat to prevent it from degrading. The Moderna vaccine is stable about 12 hours at room temperature, and then it has to be stored in a fridge, and that can be done for 28 days, like a doctor's office fridge. The other one, the Pfizer one, has to be stored at -70 or below, and that is because the mRNA degrades. And that degrading is actually a good thing for the question that you just asked regarding long-term effects. It's gone out of the body. I mean, it's broken down really, really rapidly. And that's one of the things that, again, prevents any chance of this becoming something like a polio complication that we'd expect in another sort of scenario.
Okay, good to know. Now, Crystal Farrell has a question that's related to that. Is one vaccine better than the other? And she mentions Moderna, Pfizer, and Oxford. I've never heard of Oxford. What's the Oxford one?
Pfizer is I think the Pfizer is the Oxford one. I think that's the same one. But
there's AstraZeneca, I think.
There's AstraZeneca is a different one. I think Dr. Jones or Dr. Edje may be able to. I think isn't AstraZeneca the live virus?
That's an adenovirus.
Yeah, it's an adenovirus. Yeah, it's not the mRNA. And I don't know if you could say one is better than the other, but I know that both mRNA studies, the efficacy rate was greater than 90%, which is good. Closer you can get to.
Unremarkable. I mean,
right.
Yes, it's very remarkable. Yeah.
The best virus is
Moderna and Pfizer, Dr. Thomas, right? You're talking about Moderna and Pfizer.
Moderna and Pfizer, correct. I've done studies, the clinical trials since I've been here for the last 30 years, and I mostly contraceptive trials. So I brought to market the Louito, the Moderna, the Mirena. Moderna, Mirena is starting to confuse me. But all these things, birth control pills. So anytime you get anything over 90%, you're doing well. So 90% with these vaccines is incredible.
The best vaccine is the one you can get.
Right.
Okay, I hear you, Dr. Jones.
That's true.
Get a vaccine. That is the message. Okay, so then someone is saying, and I can understand why they're asking this, is a vaccine distributed by the federal government or the state government? And I don't know, and they might be asking about accessibility, but I'm thinking they're kind of wondering, if it's distributed by the federal government, some people might have a problem with that.
I believe that the state and then the local make that decision.
Yeah, and right now there are it's coming by air and by ground. And they have got security at the airports. They've got all kinds of contingencies that have been put in place because, again, right now we've really got a shortage that is out there, and we want to make sure that the highest exposure folks are getting those first, so that we can be around to take care of everybody else.
And my understanding too is that when you all were talking about the different groups that the CDC and the ACIP, that group that tells us how to do immunizations, but the state can make its own decision, right? The state doesn't have to follow those guidelines, isn't that right?
Mm-hmm. Yes. We are following phase 1, of course, as we previously mentioned, would be the high-risk workers and congregate living, including prisons. And then stage 2 involves teachers primarily, and other folks who are higher risk, people with other comorbidities, as we mentioned. So the African-American, Hispanic community would fall into that phase 2.
Okay, great. And, you know, I want to make sure, I'm going to ask this other question. And Tropikana, I wanted you to come in with some of the myths that your listeners have been asking about, just to make sure we don't
I'm going to
forget
actually
about
pull those up. But before I do that, there is a question that I thought was kind of interesting. Once you take the vaccine, does that free you from having to wear your mask every day?
Oh,
No, no. The reason is that, and I forget which trial it is, it may have been the Pfizer trial, but there's one of the trials that actually looked at asymptomatic infection. And so what these vaccines are doing is they're decreasing your risk of becoming symptomatic, hospitalized, having severe disease, but it's not necessarily decreasing your risk of getting infected. So you could be okay yourself, but still, you know, have been infected, and potentially there's a theoretical idea that you could still potentially expose others to it if you're infected, even though you're not yourself sick.
And it does, the particles of the virus can live in your nostrils and in your airway and so forth after you've been vaccinated. So masking and social distancing are going to be here for months. Hand washing will be here forever, please. Hand washing forever.
oh my
And there's a
goodness.
lot of data to show that you have to have at least 70% of people to get the vaccine to get as much herd immunity as possible in order to decrease, to get back to what we saw as being normal prior to all of this. 70% of people have to get this vaccine in order to get there.
So we're still going to be wearing masks. Hopefully we're washing our hands anyway. That hopefully that's not just now starting, but the wearing masks and social distancing, we're going to
Don't
be
forget
doing
your
that,
thumbs.
sounds like, for the next, for what, how long? Another year? You said 5 months? How long?
At least a year.
Yeah, at least up to the next fall or so.
Yeah,
Okay.
I would say at least October. I have a huge medical meeting that is coming up in October. All of the ones that are through the summer, that I have one, which I represent Ohio, is a political one. That one, there are 1,000 people going to be at that meeting. That is canceled for in person. But we have one in October that they just send out the invite. So they're hopeful. They will easily cancel it if things don't work out the way we expect them to. But that's the earliest would be the fall.
Okay, so here's a question. Could you speak to people who have severe allergies who are EpiPen carriers?
Probably shouldn't take the Pfizer vaccine as what we know currently. And that was largely based on some of the experiences that were shown to happen in the very early rollout in England, the UK.
So then they should take Moderna, which is what you guys are all doing anyway.
We're still waiting to hear about the emergency use authorization on that. But in general, there is a concern that if you have to be protecting to the level of needing EpiPen, that you really go ahead and wait for additional information on the Moderna on that one.
Okay. And then someone says, how much will the vaccine cost? And what happens if I don't have health insurance?
It's free.
Oh, it's free? Okay. Free for everybody. Oh, that's wonderful.
The
Okay.
Moderna, the vaccine makers who participated with the federal government in Operation Warp Speed committed to that. I don't think Pfizer was a participant in Operation Warp Speed, and so I don't know how they're going to be pricing their vaccine, but the other ones who participated had to commit to that.
Right, but I think Pfizer is also, even though they didn't take money from the government, I think that theirs will also be free because the government will pay for those inoculations.
Okay, great. So here's a question from Sarah Amen. She said, I don't feel compelled to take any fast track vaccine that doesn't have adequate empirical data or clinical trials associated with it. How many years does it normally take for a vaccine to be developed?
I can take that one. One of the things that I use is the cake allergy, which I mentioned in my opening comments. Coronaviruses have been studied. There is a boatload of research that's been done for the past 15, 20 years already on coronaviruses. And if you think about this as a cake, we baked that cake and we frosted it. And all we had to do for this past year was figure out how to make the cherry to put on the very top. So this has been 20 years in the making. This is not something that was fast tracked at all. The only thing, we even knew that the outside of the virus was what we needed to target as far as our study, because we knew everything else about it.
Okay, great.
Some of the University of Cincinnati researchers in microbiology and virology on the main campus have actually been looking at messenger RNA vaccines for the last 20 plus years, back in the 80s. So this isn't anything new.
It's not
just-
fast track.
Right,
Okay.
exactly.
Fast track.
Okay. All right.
And the trials were done appropriately.
Okay.
Can I add one more thing? Which is that the size of vaccine trials usually is about 6,000 or 7,000 in phase 3. And so the reason it's going faster is that they have a huge number of sites, a large number of participants, and a disease that's very prevalent, so that you can get the participants, they can be exposed, and you can see the difference faster than for many other types of diseases.
Okay. All right, we're gonna pick up the speed just because we have a lot of questions here. Christine Moore is asking for the general population who are not part of the trial, if they have COVID antibodies, do they still need to receive the vaccine? I think you guys have already said yes, you still need the vaccine, right? Okay, so Christine, that's a big yes. And then Cy Brown said, question to Dr. Jones, did you say it will take about 12 months to get everyone injected in the country? Did you give us that number?
That's my estimate.
Okay.
I don't think that it's going to be a short-term, process, because you have to roll it out. You have to give people 2 doses of the vaccine and keep track of that. You have to hit pockets where there's very little access to healthcare, facilities and all like that. It's just going to be a big deal.
Right. So we're making progress, but it's not time to take off the mask and start getting, a little lax with that. Okay. Robert Brown said, I'm horrified by the spike we're experiencing. I'm equally concerned about the vaccine skepticism among the minority community. How can we facilitate outreach among the community and get folks to follow the rules and get vaccinated when available? The vaccine does not mean we are home free. That is a good point.
Right. And this is why we're here. We're right here now today trying to get that message out. It's very important that you listen to those of us who've gone through the trials, and it's very important to listen as other people start taking the vaccine to let people know it's okay, and to get that second shot, because that's also vitally important in this whole process.
Absolutely.
I think as we see that most of us live in communities with everyone else here in town, and so for those of us who are on the front line, who have gotten the vaccine, you will see us walking, amongst everybody else and doing fine. And so that should be proof for you. We're your neighbors, we're your friends, we're your doctors, et cetera. So, time will show the safety as well right up front for you.
Okay.
I will tell you, my daughter got COVID, and because my wife has asthma, after my second vaccine, I took care of my daughter, wore my PPE, wore my mask while she was having these fevers to 100, 100.9. But because I'd had that second vaccine, even though I didn't know what I had gotten, I did feel comfortable participating in her care, and she did fine, and I had no symptoms from the COVID whatsoever. So we'll see what happens.
Okay, and here's a question. Can my job force me to take the vaccine? I can tell you if you're in the medical profession, for sure.
Well, your job can't force you to take it, but your job can tell you if you want to work here,
right?
You should take it.
Right. Yeah, they aren't going to follow you around with a needle. And to someone who asked earlier, is the vaccine oral or is it a shot? Because they're afraid of shots. It's a shot, right? But
it's 2 shots, 21 days apart.
2 shots that could save your life. So you go ahead and just take that shot and suck it up. It'll be fine. Okay, AKA Phi Psi Omega. My question is, if you have tested positive already, a lot of people are wondering, am I out of the woods? But no, you're not. So the question again, if you've tested positive with COVID already, but your body already have memory of it, so why is it still recommended to get the vaccine?
Because the antibodies are not reliable. We don't know how long they're going to last for, and we don't know how much immunity they confer, how well they work to protect you. So they're a shield, but we don't know whether the shield has holes in it. What we do know, if you get vaccinated, then you've got a full lock, shield that is, 94% effective.
And that question, that question was actually Trina Patrick, and Trina, that was actually a really good question. So thank you for that. Yeah, I'm sorry.
When they look at go ahead.
No, go ahead, Dr. Jones.
When they look at the types of antibodies, they found that there's a range, and the type of antibody you really want is what's called the neutralizing antibody. And so these vaccines have been shown to have increased levels of neutralizing antibody. When you took the antigen test, you may have had antibodies, but you may not have had a large amount of neutralizing antibodies. And that's part of why they're saying go ahead and take the vaccine, even if you've had COVID.
Okay.
Yeah, a question from Easy Connect. He said, what does herd immunity mean?
It means that you have enough people around who either have made it through the infection or have been vaccinated, that when the virus comes to get you as a vulnerable person, it can't find you amongst all those folks who are already immune to it. You know, the virus has to be transmitted person to person. And so if you're in a crowd of 100 people and 80% of them are already immune, the virus is like, can I go here? Can I go there? But it can't find you, even if you haven't already been infected. That's the herd immunity analogy. Now, if you only have 1 or 2 people who have been infected, and and you haven't had the vaccine out, that virus comes in and it's going to see 96 people that can hop boom, 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 all the way around, and it can get to you because it can find enough of a path through that crowd to still get to you. I don't know if that makes sense.
It did.
Yeah, that makes sense for sure. Okay, here's another question. This is from Sarah Amen. Are the numbers of deaths inflated? If a person has complications from another pre-existing condition and contracts COVID, why does the death certificate reflect COVID as the reason for expiration? That's a good question.
Because you probably weren't going to die today unless you got the COVID.
So COVID is still the cause of death.
Right. If you have heart disease.
Not inflated, right?
Right. If you have heart disease and you were going to die in 12 years from now because of whatever, but you die today because of the stress of the COVID infection, it doesn't matter what all you had. You weren't going to die right now.
Right. So, so Ashley Glass says, there's been some coverage saying people have been getting Bell's palsy after taking the virus. Is this information valid?
I haven't read any data on that. The side effects have been 5 major things. Fatigue. For some people, they have had a headache, low-grade fever, possibly muscle aches, and possibly joint aches. Those have typically lasted no more than a day, and there've never been anything that would have allowed the person to be in a situation where they would not want to go to work. So that's for the Moderna trial.
Can I add something? There has been a report of, I think it's 2 people who had Bell's palsy, possibly, if I remember right, in the Pfizer trial. Now, the thing about Bell's palsy is that there's a rate of Bell's palsy in the general population. And so in a trial the size of the Pfizer trial, you would expect anywhere from 6 to 9 people to get Bell's palsy anyway, whether or not they had been exposed. So now you have 2 people, what you really want to be doing, and I'm sure they're going to be monitoring that, is to see whether or not you're having Bell's palsy occurring only in the treatment group, because that would be the question is the treatment causing it, as opposed to, well, people get Bell's palsy, and so some people did during the trial, but it's not related to the trial.
So when we go to get the vaccine, it sounds like it's not going to be until the spring or summer for most of us. And that's another question that people should weigh in on. Like, when will most of us get it? But when we get it, do we get to choose which one of these we want? Like, I want Moderna. I'm just thinking, given everything you all are saying, I want the one you guys have.
Now, I think that what's going to happen, you're going to get the vaccine that you get. I can see that one of my friends from Phoenix is online here watching. And they will probably get something else. It may end up being regional, but it will be, you will get what you get. You're either going to get, I guess, either right now the Moderna, which will come up soon, or Pfizer, and at some point probably the other one, AstraZeneca. But it will depend on where you are and where you probably get it. But the most important thing is to get one of those vaccines.
Okay.
And so one of the things just to mention as well is that, it's 2 shots. And they're 21 days apart. You can't get one Pfizer and then the other one Moderna. You have to get the same one, from the same trial. So what the companies have been required to do is once they give you one, they've got another one sequestered So they match them out like that. So just to know that.
Okay. But as Dr. Jones said, the vaccine that you want is the one you can get. So I will keep that in mind. Okay, here's another question from Facebook. And so Ms. Beckham, this is a good one for you. Does a nurse have to administer the vaccine, or can you go to a pharmacy and just get it?
Oh yeah, pharmacies can get it. CVS and Walgreens are at the top tier of advertising for the vaccination. So you can go to your local pharmacies to get it as well.
Okay. And then here's a question from Kelly Prather. And she's asking Dr. Jones, would you recommend the vaccine for cancer survivors in the first year of remission? Do cancer survivors need to wait?
I think that's a good question, and I have to look at the trial documents more carefully. I know that there were some people with cancer who were allowed in the trial and others who were not. And so the question is, that's a subgroup analysis to look and see for, for people who have that particular demographic, when they put out all the data, how did they do? That's what you would have to look at.
Okay. Now here, I love this question from Easy Connect. He says, how is it that they can quickly find a vaccine for COVID-19 and yet they've not found a cure for diabetes? How do we prioritize?
They put a whole lot of money behind it.
I'm sorry, I was talking. Go ahead. Please say that again. I didn't mean to cut you off.
Oh, I said they put a whole lot of money behind that.
Well, probably one of the other questions is there was an analogy about why were we able to find a good vaccine against the coronavirus, but not say the HIV virus. And the answer is actually the mutations. The HIV virus mutates a lot. You can't find something that can fight the HIV infection, whereas this is not mutated as much. So therefore, it's a little bit easier to get under control. As far as diabetes, there's a whole range of questions related to diet, exercise, McDonald's, Kentucky Fried Chicken. There's a lot of things associated with diabetes and genetics. So that's a different question. But as far as attacking viruses, there is less mutation in this virus so far, and we'll see what happens over the years.
The biggest difference for me with respect to the diabetes question, I take care of diabetics as part of my day job. Diabetes is not an infectious disease. Right. And so it doesn't have vaccines that we use against it at all. It's genetic based. It is environmental based from the standpoint of diet and exercise, just as Dr. Thomas mentioned. So totally different question, but a good question.
Yes. Okay. Someone is asking here, originally this virus was advertised as a surface virus. Now it's said it's airborne. What's the truth? Or is it both?
It is both. It is airborne as well as contact as well. That's why some people say, hey, I've been wearing my mask all along and I'm still getting it. Sometimes when you go to the grocery stores and you touch certain things, they can live on different surfaces for 24 hours up to, 2, 3, 4, 5 days. So you really have to be careful about both.
Okay.
And you see people who aren't really protecting themselves. You see people with a mask, but the mask isn't on here. I go to the Kroger down here at Kennard. People don't wear masks, and but they're masked there. Or you just have to be fully protected, and you should also wear eyewear. That's the other thing. That's another avenue that people can potentially get the viruses through the eyes. So
because if you can rub your eyes and
exactly. So until we can get the virus and protect ourselves, we still and will continue for a long time to have to use masks and eyewear.
Okay. And so another question from Facebook. This is from Annette Bell. She says, am I understanding Moderna and Pfizer are not live? They're not the live virus, but the AstraZeneca is the live vaccine. I think the answer is yes, but does someone want to confirm that?
It's a live virus, but it's not the coronavirus virus.
Right, not the coronavirus. Okay. So none of them have none of them are injecting the coronavirus into you, but Moderna and Pfizer are not injecting any virus into you.
That's correct.
Okay, that's good to know. And then Cy Brown wants to know from Ms. Beckham, are you doing workshops? Oh, my question just left. Are you doing similar workshops for your organization to keep them in the loop on COVID-19?
similar workshops for just the MPs by themselves or for the community?
Okay, he didn't say, but let's just say for the community. Okay.
Oh, yeah. So we've actually created different PSAs to urge people to get informed with the correct information. We also have had this similar platform with the Urban League as well, just to talk about the specifics, evidence-based practices, and data about the coronavirus and the vaccine as well.
Okay, great. And Robert Brown earlier said he was saying cheers to Dr. Kizzy Corbett. So I wanted to give a shout out to Dr. Corbett.
I'm a fan. I'm a real fan.
Yeah,
She's
I'm a fan of
amazing.
hers
She's
too.
34
Haven't
years
met her
old.
yet, just heard about her, but yeah, she's a star. But Robert Brown's question is, well, he has two things here. One, he says, expect the 1% to exercise its privilege and find ways to get preferential vaccine access. Okay. Any comments on that? He's talking about who's going to get it. And that's back to, you know, are the rich and famous going to jump in front of all the people who are really supposed to be priorities? I'm not sure what we can do about that, folks, but.
So I will just say this, that number one, there are approximately 150,000 frontline workers here in the greater Cincinnati area, including EMS, who will need to be in that 1A tier to get the drug. Right now, we have about 1/10 of what we need for one dose when we're meant to be getting two. So it is very scarce. It is being handled with the utmost care. There are all kinds of plans in every single hospital to determine who actually gets it first. Again, you've got a very small amount currently with the Pfizer. We should expect obviously many thousands of doses more with the Moderna. But I think our frontline workers, these are put into the hands of folks that we trust and within our hospitals. So I can't right now see a way that the rich and famous are going to be able to get their hands on this at this point in time. I can't see that happening. Certainly everything's possible, but frontline workers, the fact that EVS, so our environmental services, are on the list because our hospital at UC Health understands that a lot of us do jobs that are from top to bottom and keep us safe. They're all equally important. They are in line, just like the surgeons are who take care of patients who have disease as well. So that for me is reassuring that they have their heart in the right place. There is also a regional allocation committee that has been in place since April that is responsible for deciding when you've only got a limited supply of ventilators, or you've only got a limited supply of remdesivir, which is one of the drugs that's been used for this in the past. And there's only a limited supply of ECMO machines, which help people to breathe when they're in significant trouble. There's a committee of people who have already got some ethical chops already in place that these things funnel through. And they involve people from all walks of life, and they include people who look like us as well. Right. So, again, I'm reassured by that. Anything can happen, but I can just tell you that there have been a lot of things put in place to try and make sure that doesn't happen.
I can assure you, from a University of Cincinnati, College of Medicine, UC Health standpoint, every vial will be accounted for. No one's going to get medications who's not slotted to get medications. It's not going to be your cousin or your play cousin. It'll be the people who are on that list who will get the vaccines first, and that list will be followed specifically so that people at the highest risk or people who are at the highest exposure will get the medication.
Okay, thank you so much. We are running out of time. I want everyone to know we're going to continue this conversation next week. I'm going to end with, there's a final question here. And this is someone who says, if I just stay in my house, can't I just continue to wait it out? So I'm going to say to you, get in line, get that vaccine, because at some point you're going to have to come out of your house. Okay, we don't want anyone just sheltering in place forever. So thank you, all of you. I want to turn it over to Tropikana for some closing remarks, and she's going to turn it over to Renee. You guys are awesome.
You guys are amazing. Thank you so much, Dr. Edje, Dr. Thomas, Dr. Jones, Nurse Practitioner Felicia Beckham. Thank you for joining us, and thank you for your service to the community and all that you have done for us. And thank you for sharing your brilliant minds with us and answering so many questions. With no further ado, I would like to bring on Miss Renee Mahaffey Harris, our brilliant CEO and Organizer, go ahead.
Wow. Well, thank you for all those accolades, but I want to commend our panel. You all were incredible and provided such great information. The goal of us doing this work through COVID-19 communityresources.com, brought to you by the African American Chamber of Commerce, Eric Kearney, the Urban League of Greater Cincinnati, Eddie Cohen, Joe Mallory, president of the NAACP, and Dr. Roosevelt Walker with Cincinnati Medical Association, and our council member, Jan-Michele Kearney, we came together in March when COVID-19 hit us in this United States and said, we need to make sure we have trusted ways to get information to Black people in particular about COVID-19 and now about the vaccine. So these town halls are brought to you by all of us. And most importantly, I want to share with you that next week we'll be launching a campaign that will be reinforcing what we need to do to protect us, what we need to do to save us. And so next week, we will also have another continued conversation on the vaccine with someone from Pfizer, as well as representation from Children's Hospital and Dr. James Powell from the National Medical Association and Cincinnati Medical Association. I am so grateful for all of you. Together, I know that we can save our lives. And as we continue to share information and dismiss myths and give information to correct myths, it's up to us to get the right information so that we can share it with one another. So I thank all of you for your time, and please remain safe, mask up, social distance, and wash your hands. Thank you all.
Thank you so much.
Thank you. Thanks, everybody. You're awesome.
Thank you, Jan-Michele.